Hey everyone, welcome back to Bugs and Beyond. You know we love to bring you the latest and greatest in the world of infectious diseases. And today we're going to take a deep dive into a medication that's probably pretty familiar to a lot of you. We're talking about nitrofurantoin. Now we've got a whole stack of research articles, clinical guidelines, even some pretty cool historical tidbits about this little wonder drug. And to help us sort through all of this information, we have our amazing pharmaceutical expert.
Hello, happy to be here.
Now, before we jump into the nitty-gritty, let's set the stage a bit. Nitrofurantoin is an antibiotic many of you have probably heard of or maybe even taken yourself. And it's mostly known for its role in fighting urinary tract infections, those pesky UTIs. But as with any medication, there's a lot more to the story than just what's on the surface. So in this deep dive, we're going to explore everything from its humble beginnings to how it actually works in the body to some of the more nuanced considerations when it comes to using it safely and effectively. So buckle up and get ready for a wild ride through the world of nitrofurantoin.
I'm excited to take this journey with you. You know, nitrofurantoin's been around for a while, actually. It was developed way back in 1953, which is kind of mind-blowing when you think about it.
1953, wow. That's like ancient history in the world of medicine.
Ah.
So back then, what was the situation with UTIs? I mean, were they just as common as they are now?
Oh, definitely. UTIs have always been a common health issue, especially for women. And back then, treatment options were pretty limited.
So nitrofurantoin must have been a real game changer when it came on the scene.
It was a real breakthrough. It quickly became a go-to treatment for UTIs because it was so effective against the bacteria that typically cause them, especially E. coli. But there was a bit of a catch.
Oh, what was that?
Well, the early formulations of nitrofurantoin, they weren't exactly known for being gentle on the stomach.
Ah, I see. So some tummy troubles.
Yeah, unfortunately, that was a common side effect with those early versions.
So what happened? Did they just abandon the ride altogether?
No way. Scientists knew they had something special with nitrofurantoin, so they kept working on it, trying to find ways to improve its tolerability.
And that's how Macrobid came about.
You got it. Macrobid is a newer formulation of nitrofurantoin that's absorbed more slowly by the body, and that slower absorption makes a big difference in terms of reducing those stomach upset side effects.
So it's like nitrofurantoin got a makeover and came back even better than before.
Exactly. Same great bacteria-fighting power, but with a much smoother experience for the patient.
I love that. It's like an upgrade for our bodies. But okay, let's back up a bit and talk about how this wonder drug actually works its magic against those UTI-causing bacteria.
So picture this nitrofurantoin. It's like a tiny ninja warrior that sneaks into the bacterial cells.
I'm Ninja Warrior. I like where this is going.
And once it's inside, it starts disrupting all sorts of essential processes that the bacteria need to survive. It interferes with their DNA replication protein synthesis, even their ability to build their cell walls.
Wow, so it's like a multi-pronged attack.
Exactly. It basically throws a wrench into the bacteria's entire operation. And the best part is that it's pretty selective in its actions.
What do you mean by selective?
It mainly targets bacterial cells, leaving our own human cells relatively unharmed.
Oh, that's great. So it's like a precision strike against the bad guys without causing too much collateral damage.
You got it. And that's one of the reasons why nitrofurantoin has been such a valuable tool in treating UTIs for so long.
Okay, so we've got this Ninja Warrior that's wreaking havoc on the bacteria. But how does it actually get to the battlefield? I mean, how does it travel through the body?
So think of it this way. You swallow a nitrofurantoin tablet, and from there, it embarks on a journey through your digestive system. It gets absorbed into your bloodstream pretty efficiently, about 90% bioavailability, which is impressive.
90%. That's like a direct flight to its target.
Pretty much. And from the bloodstream, it makes a beeline for the urinary tract, reaching high concentrations in the urine.
That's why it's so effective against UTIs. It goes right to the source of the problem.
Exactly. It concentrates right where it's needed most, creating like a fortress against those bacteria.
So we've talked about Macrobid, which is the newer, gentler version, but you mentioned earlier that there are actually different formulations of nitrofurantoin.
You're right. There's also a macrodantin.
Macrodantin.
Yeah.
Okay, so what's the difference between the two, and why should we care?
Well, both macrobid and macrodantin, they both contain nitrofurantoin. But they differ in their composition and how they're absorbed by the body. Macrobid, like we said, is absorbed more slowly, which makes it easier on the stomach, and it's typically taken twice a day. Macrodantin, on the other hand, is absorbed more quickly, and it's usually taken 4 times a day.
So macrodantin is kind of like the slow and steady wins the race approach, while macrodantin is more like a quick burst of energy.
That's a great analogy. And in general, macrobid is often preferred because it's usually better tolerated.
Got it. So if you're prescribed nitrofurantoin, It's worth asking your doctor about which formulation might be best for you.
Absolutely. They can help you weigh the pros and cons and make the right decision based on your individual needs.
Okay, now I got to ask you this because I've always been curious about this. When it comes to taking nitrofurantoin, does it matter if you take it with food or on an empty stomach?
That's a great question. And the answer is yes, it actually does matter. Taking nitrofurantoin with food can significantly improve its absorption and reduce the chances of stomach upset.
So it's like giving it a little escort through the digestive system.
Exactly. The food helps to buffer the medication and makes it easier on the tummy.
Okay, so always take it with food. Got it. Now, before we move on, I want to make sure everyone's following along. So let's do a quick little quiz to test your nitrofurantoin knowledge. Imagine you're prescribed microtobid for a UTI. How often would you typically take this medication? Is it A, every 4 hours, B, every 6 hours, C, every 8 hours, or D, every 12 hours? I'll give you a few seconds to think about it.
Take your time. The answer is just to swallow it.
Yeah, time's up. The correct answer is, drum roll please, D, every 12 hours.
That's right. Macrobid is typically taken twice a day, about 12 hours apart.
Exactly. And that's one of the reasons why it's so popular. It's convenient and effective, fitting nicely into most people's daily routines. But now this brings up another important question. What about people with kidney problems? Can they still take nitrofurantoin?
That's a really important consideration, and that's where things can get a bit more complex.
Ooh, sounds intriguing. We're going to have to save that discussion for part 2 of our deep dive. But trust me, it's worth the wait. We'll be back to unravel the mysteries of nitrofurantoin and kidney function.
We'll also explore some of the potential side effects, drug interactions, and the bigger picture of antibiotic stewardship.
So don't go anywhere. We'll be right back with more nitrofurantoin adventures after a short break.
All right, so we're back and ready to tackle those trickier aspects of nitrofurantoin, especially when it comes to kidney function.
You know, it's interesting because when I think about the kidneys, I think about them like a filter system for the body. So how does nitrofurantoin actually interact with the kidneys, particularly if those filters aren't working as well as they should be?
That's a great point. And it's crucial to understand that relationship because the kidneys are the primary route for eliminating nitrofurantoin from the body. So if the kidneys aren't functioning optimally, the drug can build up, and that can potentially lead to some issues.
Ah, that makes sense. So like having a backlog in the filtration system.
Exactly. Now, traditionally, guidelines have advised against using nitrofurantoin in patients with significantly impaired kidney function, specifically those with a creatinine clearance below 60 milliliters per minute. And creatinine clearance, that's basically a measure of how efficiently the kidneys are filtering waste products from the blood.
So if the creatinine clearance is low, that's a red flag that the kidneys might be struggling.
Exactly. But here's where things get a little bit interesting. More recent research has actually challenged those traditional guidelines. Studies have suggested that short-term use of nitrofurantoin might be safe and effective even in patients with slightly lower kidney function, potentially even down to a creatinine clearance of 30 to 60 milliliters per minute.
So it seems like our understanding of nitrofurantoin and its use in patients with kidney issues is evolving.
Absolutely. Medical science is always advancing, and we're constantly refining our knowledge and treatment approaches.
Well, that's good to know. It's reassuring to see that the guidelines are being updated based on new evidence. Okay, so we've talked about the kidney considerations, but are there any other potential long-term side effects that people should be aware of, especially if they're taking nitrofurantoin for an extended period?
Yeah, that's a great question. While nitrofurantoin, especially macrobid, is generally well-tolerated, long-term use can sometimes lead to some issues. One potential concern is pulmonary toxicity, which affects the lungs.
Pulmonary toxicity. That sounds serious.
It can be, but thankfully it's relatively rare, particularly with short courses of treatment. It's more likely to occur with prolonged use, especially in older adults.
So what exactly happens with pulmonary toxicity?
Essentially, it involves inflammation or scarring of the lungs, which can cause breathing difficulties.
So what should people look out for? Are there any warning signs?
The symptoms can be subtle at first, things like shortness of breath, a persistent cough, or unusual fatigue. So it's really important to be vigilant, and if you experience any of these symptoms while taking nitrofurantoin, especially long-term, you should definitely seek medical attention promptly.
So it's better to be safe than sorry.
Absolutely. Another potential concern with long-term use is peripheral neuropathy.
Peripheral neuropathy. Now that one rings a bell. I've heard of that before.
It affects the nerves, particularly in the extremities like the hands and feet.
Isn't that the one that causes that tingling or pins and needles sensation?
Yeah, exactly. Symptoms can include tingling numbness or even weakness in the hands and feet. Again, this is more common with long-term use, and it's usually reversible once the medication is stopped.
So regular checkups with the doctor are probably a good idea if you're taking nitrofurantoin for an extended period.
Definitely. Regular monitoring can help catch any potential issues early on.
Okay, so we've covered some of the potential long-term side effects, but what about drug interactions? Sometimes medications can clash with each other and cause problems.
Right, you are. It's like a delicate dance in the body, and sometimes those dance partners don't quite get along.
I've heard that antacids, those over-the-counter medications for heartburn, can sometimes interfere with certain medications. Is that true for nitrofurantoin?
You're right to be cautious. Specifically, magnesium-based antacids can reduce the absorption of nitrofurantoin, making it less effective.
Oh, so it's like the antacid is stealing nitrofurantoin's thunder.
You could say that. So it's generally best to avoid taking those types of antacids within an hour or two of taking nitrofurantoin.
Got it. Any other medications that people should be mindful of when taking nitrofurantoin?
Another one to keep in mind is probenecid, which is sometimes used to treat gout. Probenecid can actually increase nitrofurantoin levels in the bloodstream, potentially raising the risk of side effects.
So it's like probenecid is amplifying nitrofurantoin's effects, which might not always be a good thing.
Exactly. Your doctor might need to adjust your nitrofurantoin dosage if you're also taking probenecid.
So communication with your doctor is key. Let them know about all the medications you're taking, even over-the-counter ones.
Absolutely. It's all about teamwork and making sure all the medications are working together harmoniously.
Speaking of teamwork, let's zoom out a bit and talk about nitrofurantoin's role in the bigger picture of antibiotic stewardship.
Antibiotic stewardship, a critical concept. It's all about using antibiotics wisely and responsibly to preserve their effectiveness for the long haul.
It's like we're trying to protect these valuable resources from overuse and misuse, which can lead to antibiotic resistance.
Exactly. And nitrofurantoin plays a really important role in those stewardship efforts because it's considered a narrow-spectrum antibiotic.
Narrow spectrum, so that means it targets specific types of bacteria rather than just wiping out everything in its path.
Precisely. By using narrow-spectrum antibiotics like nitrofurantoin, when appropriate, we can minimize the collateral damage to our body's natural microbiome.
The microbiome, there's like the trillions of bacteria that live in and on us, right?
That's right. And those bacteria, they're actually essential for our health. So by using narrow-spectrum antibiotics, we can help preserve that delicate balance.
It's like being a responsible gardener tending to our internal ecosystem.
I like that analogy. And by using narrow-spectrum antibiotics, we're also helping to reduce the selection pressure that drives antibiotic resistance. So we're playing a part in keeping these valuable medications effective for future generations.
So it's not just about treating the immediate infection, it's about thinking long-term and protecting the future of antibiotics.
Yeah. You got it. Now, to really understand how nitrofurantoin is used in practice, let's dive into some real-world scenarios.
Case studies. I love case studies. They help bring these concepts to life.
Absolutely. So let's say we have a young woman, Sarah, who comes to the clinic with all the classic symptoms of a UTI. Frequent urination, that burning sensation, and the urgency to go all the time.
I can sympathize. UTIs are no fun.
Definitely not. So her doctor does a urine test, which shows a high white blood cell count indicating infection. And they also identify the culprit, E. coli, a very common cause of UTIs.
So it's like a detective story, but for bacteria.
I love that. So in this case, nitrofurantoin is a great first-line option because it's so effective against E. coli, and it concentrates well in the urine.
So it's like sending in a specialized team to target those E. coli invaders.
Exactly. But let's look at another scenario a bit more complex. We have an older gentleman, John, who has a history of chronic kidney disease, and he presents with similar UTI symptoms.
Now this is where those kidney considerations come into play, right?
Exactly. In John's case, his doctor would need to carefully assess his kidney function, looking at his creatinine clearance and other factors, and then weigh the benefits and risks of using nitrofurantoin. If his kidney function is significantly impaired, there might be alternative antibiotics that would be a safer choice.
So it's really about personalized medicine, tailoring the treatment to the individual patient.
Absolutely. Each patient is unique, and treatment decisions need to be made on a case-by-case basis.
Well, this highlights the importance of open communication with your doctor. Asking questions and making sure you understand your treatment plan.
I couldn't agree more. It's a partnership between the patient and the doctor.
Now, I know we've got some eager listeners out there who have sent in some questions, so let's tackle some of those, shall we?
I'm always excited to hear from our audience. Fire away.
Okay, first question comes from Sarah. And she asks, I've heard that nitrofurantoin can interact with certain foods. Is that true?
Great question, Sarah. While nitrofurantoin isn't known to have significant interactions with specific foods, it's always a good idea to talk to your doctor or pharmacist about any potential dietary considerations, especially if you have any food sensitivities or allergies.
So it's always best to check with the experts.
Absolutely. All right, next question comes from David. He wants to know more about that interesting side effect of turning urine brown. He asks, is it really that noticeable, and should I be concerned?
I have to admit that one always makes me chuckle. It's like nitrofurantoin's little signature.
It definitely catches people's attention. But David, I want to assure you, it's a harmless and temporary side effect. It's simply due to the way the drug is metabolized and excreted from the body.
So no need to worry, it's just a little color change.
Exactly. And last but not least, we have a question from Maria. She asks, what's the best way to remember when to take nitrofurantoin?
That's a good question because remembering medication schedules can be tricky.
It definitely can. One helpful tip is to link taking nitrofurantoin with a regular activity in your daily routine, like brushing your teeth or having meals. For example, if you're taking Macrobid twice a day, you could take it with breakfast and dinner.
So it's like creating a mental association to help you remember.
Exactly. And of course, always follow your doctor's instructions and the information on the prescription label.
Right on. So we've covered a lot of ground in this part, from kidney considerations and long-term side effects to drug interactions and antibiotic stewardship. It seems like the key takeaway is that while nitrofurantoin is a really valuable tool for treating UTIs, it's not without its nuances and potential risks.
Absolutely. It's crucial to use it wisely and understand both its benefits and its limitations.
And speaking of understanding, we've got one more part to go in our nitrofurantoin saga. We'll be traveling back in time to explore its fascinating history, and we'll even peek into the future to see what might be on the horizon for this remarkable medication.
Plus, we'll answer a few more listener questions, so stay tuned for the grand finale.
All right, everyone, welcome back for the final part of our nitrofurantoin deep dive.
I'm ready for the grand finale.
Me too. You know, in the last two parts, we've talked about how nitrofurantoin works, how it's used, some of the safety considerations. But now I want to step back and look at the bigger picture. Like, where did this medication come from? What was the world like when it was first discovered?
A journey back in time. I love it.
So let's set the stage. It's the 1950s. What's going on in the world of medicine?
Well, the 1950s was a really exciting time for medicine. You know, penicillin had already revolutionized the treatment of bacterial infections, but scientists were eager to discover new antibiotics. And UTIs, they were just as common back then as they are now.
So there was definitely a need for new treatments.
Absolutely. And then in 1953, nitrofurantoin emerged on the scene.
1953, so it's been around for quite a while.
It has. And it quickly gained recognition for its effectiveness against those UTI-causing bacteria, especially E. coli.
So it was a welcome addition to the antibiotic arsenal.
It was. But as we talked about earlier, those early formulations had some drawbacks, particularly with those stomach upset side effects.
Right. Those early versions were a bit rough around the edges.
They were. But thankfully, scientists didn't give up on nitrofurantoin. They kept refining it and eventually developed the better absorbed formulations like Macrobid that we use today.
So it's a story of perseverance and innovation.
Exactly. And it's a testament to the power of science to improve medications and make them more tolerable for patients.
Now let's shift gears and fast forward a bit. What about the future of nitrofurantoin? Are there any exciting new developments or potential uses on the horizon?
Oh, there's some really intriguing areas of research. One avenue that's generating a lot of buzz is combining nitrofurantoin with other antibiotics.
Combining antibiotics. What's the thinking behind that?
Well, the idea is to create like a 1-2 punch against bacteria. By combining different antibiotics, we can potentially enhance their effectiveness and overcome those tricky resistance mechanisms that bacteria can develop.
So it's like a team effort to fight those tougher infections.
Exactly. And it could be particularly helpful in cases where bacteria have become resistant to one antibiotic.
That's really interesting. Any other promising areas of research?
Here's where it gets really cool. Some studies have suggested that nitrofurantoin might have some hidden talents beyond its antibacterial effects.
Hidden talents. I like the sound of that.
It might have anti-inflammatory and antioxidant properties.
Wow. So it could potentially have applications beyond just treating UTIs.
Exactly. Researchers are exploring those possibilities, and it's a really exciting area of research.
Okay, so before we wrap up, I know we have some more questions from our listeners.
Let's hear them.
All right, here's one from Sarah. I've heard that cranberry juice can help prevent UTIs. Is there any truth to that?
The cranberry juice myth. It's a popular one.
Yeah.
There's some evidence to suggest that cranberries contain compounds that can prevent bacteria from sticking to the walls of the urinary tract. But the research on cranberry juice and UTIs is mixed, and most studies haven't shown a strong benefit.
So it might not be the UTI miracle cure that some people believe it to be.
Probably not. But if you enjoy cranberry juice and find it helpful, there's no harm in drinking it.
Okay, here's another question. This one comes from David. Can men take nitrofurantoin?
Absolutely. While UTIs are more common in women, men can definitely get them too. And nitrofurantoin can be an effective treatment option for men with UTIs.
So it's not just a women's medication.
Not at all. It's all about targeting those bacteria regardless of gender.
All right, and one last question. This one's from Maria. Is it safe to take nitrofurantoin if I'm breastfeeding?
That's a really important question, Maria. And it's always best to err on the side of caution when it comes to medications and breastfeeding. Nitrofurantoin is generally considered safe to use during breastfeeding, but small amounts can pass into breast milk. So it's important to talk to your doctor to weigh the risks and benefits and make sure it's the right choice for you and your baby.
So, as always, open communication with your healthcare provider is key.
Absolutely. They can help you navigate those decisions and provide personalized guidance.
Well, that brings us to the end of our nitrofurantoin deep dive.
It's been quite a journey.
It has. We've explored its history, its mechanisms, its uses, its potential side effects, its role in antibiotic stewardship. And we've even peeked into the future to see what might be on the horizon for this fascinating medication.
I hope our listeners have enjoyed learning about nitrofurantoin as much as we have.
Me too. Remember, knowledge is power. By understanding our medications, we can make more informed decisions about our health. And of course, we always encourage you to talk to your doctor or pharmacist if you have any questions or concerns.
They're your best resources for personalized advice.
So thank you for joining us on this deep dive into the world of nitrofurantoin. And don't forget to hit that like button, subscribe to our channel, and share this episode with anyone who might find it helpful. We're always exploring new topics in the world of infectious diseases, so stay tuned for more exciting deep dives. Until next time, stay curious, stay healthy, and keep those microbes in check.